When patients present to me with complaints of an irregular rhythm or palpitations, my job is to try to sort out what this symptom is related to. There are several techniques at my disposal in order to accomplish this. Ideally, what we want to do is be able to record the rhythm at the time the patient is having symptoms. So what I want to do is determine whether this symptom is present all the time, every single day, or whether it is sporadic, occurring only occasionally. The next question is, if it is sporadic, is it something that is long-lasting, or is it fleeting? Depending upon that, I will determine what sort of heart rhythm recording device to prescribe to the patient to utilize. In the case of heart rhythm problems that are present on a daily basis, we can use what we call a 24-hour Holter monitor or ambulatory monitor. The patient is hooked up to the device, wears it for a complete 24 hours, and then the device is taken off. It records every heartbeat, which is then analyzed by a computer and is able to be scanned by me to look to characterize whether they're having premature beats or some other rhythm problem. The patient will additionally maintain a diary of their symptoms and is able to use the recorder to mark when they are having a specific symptom. Another type of device that we utilize is called an event monitor or an event recorder. This is most commonly a small box about the size of a credit card. And when the patient is having symptoms, they can apply it directly to their chest, press a button, and hold it there for 30 seconds. That rhythm is then stored into the device. The patient then calls and holds the device over the telephone, presses a button, and it makes a tone that is transmitted through to a computer that will then translate that into an EKG rhythm strip that is sent to the office. The third type of device that we utilize is sort of a hybrid of the two, called a loop monitor. This is useful for patients that have very short rhythm problems or rhythm problems that may cause them to become incapacitated where they're unable to pull out and hold the device onto their chest. With this, they wear the monitor all the time and it constantly plays over on itself. When they have a symptom, they're able to press a button and lock in a snapshot from before they press the button to afterwards. The devices also have the capacity of automatically recording certain specific rhythm problems, so if their heart is either too slow or too fast, it'll take a snapshot and store it in the device for us to record it. We then put this information together, correlating the rhythm that the patient is having with their symptom to be able to determine whether there is any pathology. Another important measure for us in terms of the overall health of the heart and in correlating with certain rhythm problems is looking at the structure and function, which we typically do with what we call an echocardiogram. An echocardiogram is an ultrasound analysis of the heart that enables us to take pictures and look at the size of the heart, the wall thickness, and how the heart is squeezing, including how the valves are functioning. We know that people who have structural abnormalities of the heart are definitely more prone to more serious rhythm problems than those who have a structurally normal heart.